So today's topic is diuretics. Actually, what is diuretics? Diuretics are the agents which promotes the diuresis. Diuresis, it means increase the production of urine. What is urine? Urine is the removal of excess of water which is present in our blood from the body. So urine may also contain salt, urea. Okay, so if the level of urine increases, it means the level of water in blood get decreases. So the blood volume get decreases. Blood volume is directly proportional to blood pressure. So if the blood volume get decreases, blood pressure is also decreases. So this is the normal mechanism of the diuretic. Okay, so what is the definition of diuretic? Diuretics are the agents, any drug that increases the flow of urine, that is, it increases the diuresis. It promotes the removal from the body of excess water, salt, metabolic product, that is urea, because urine contain water, salt, metabolic product, and that is urea. Okay. So generally in which condition we can use diuretic? First is heart failure, cardiac failure condition. Second is liver cirrhosis. Cirrhosis, it means damage of cells, damage of tissues. Hypertension, increase the blood pressure. Kidney diseases. Okay, then poisoning. Poisoning will include alcohol poisoning, barbiturate poisoning, etc. Okay, so this is the classification of diuretic, which is most important point which will ask in your semester exam. So in classification we should write the types of diuretics with minimum 2 examples, but we also knows the mechanism of that particular diuretic. Okay, so first is loop diuretic, example furosemide, torsemide, thiazide, chlorothiazide, metolazone. Potassium sparing diuretic, amiloride, spironolactone, carbonic anhydrase inhibitor diuretic, acetazolamide, methazolamide, osmotic diuretic, mannitol, urea, calcium sparing diuretic, thiazide, and potassium sparing, because the mechanism of action of calcium sparing diuretic is the combination of thiazide and potassium sparing diuretic. How the urine get formed? So it will start from this part. This part is called as Bowman's capsule, which contains the glomerulus. Okay, filtration will occur from here. Then this part is called as proximal convoluted tubule. This is the nephron structure which is present in our kidney. Okay, so this is the proximal convoluted tubule, over where the sodium bicarbonate get reabsorbed. Okay, then this part is called as descending limb of loop of Henle, where the water get reabsorbed, sodium ions get reabsorbed 65 to 75%. Okay, then this part is descending limb of loop of Henle. This is the symporter for the transportation of sodium, potassium, and chlorine ions. This is the distal convoluted tubule. Over here sodium and chlorine get reabsorbed 5%. Okay, this part is called as collecting duct. Over here antidiuretic ADH hormone is present, so water is reabsorbing. This is the antiporter for the transportation of sodium and potassium ions. Okay, now actually what is absorption and reabsorption? Absorption is the blood to tubular fluid. The absorption of any salt, any metabolic product, water molecule, any ions get absorbed from blood to tubular fluid. The tubular fluid is also called as pre-urine. Reabsorption is it means again an absorption. The salts or the metabolic products which are absorbed by absorption get again absorbed, and that's why we can call it as reabsorption. Okay, so the reabsorption is the salts, metabolic products, or any else get absorbed from tubular fluid to